Okay, so guys, hello and actually welcome. And I think now this meeting is being streamed live for all the participants out here. Okay, so I think it should be, I think that should be interesting because all of you should be able to now watch it live on YouTube as well on our channel. Okay, so we will start the session now. And thank you, Paresh sir, for just being online like this for me. And see, the topic is a very simple topic. What we are going to discuss is actually management of recurrent but non-infective white discharge. Okay. Now see, this in family physician practice is very, very common. Absolutely common in family physician practice. All of you, be it a male family physician or be it a female family physician, you are going to get patients who are going to come and tell you that, they are having white discharge. Okay, now this is also very common in the younger girls these days. So please, let's start from that. In the young girls, the most common cause for non-infective white discharge in India is obesity. Okay, and I'm sure all family physicians are absolutely aware of this fact that a lot of these young girls who have obesity are also developing a lot of white discharge simultaneously. Okay, so that is something which you have to keep in mind. Because it is non-infective, see, I understand there will be many family physicians who are not going to be in a position to examine these patients. Okay, there are going to be many family physicians who are going to say that I am a male family physician, it is not possible for me to go and do an examination of the female who is unmarried. But please remember this, for unmarried females the examination of choice is by doing something called as a vaginoscopy. So that is your examination of choice. You have to put a vaginoscope so that the hymen stays intact. You do not compromise on her virginity. You have to put a vaginoscope inside, and when you put a vaginoscope, you can identify what is there inside. Remember, most of these times, the non-infective white discharge, which we are trying to talk about, is predominantly going to occur because of hormonal changes onto the cervix. So normally, if you try to see, this is the uterus, right? Now, normally, when we try to understand that how it works, this is where the cervix is. This is exactly where the cervix is, the mouth of the uterus. Okay, very simple. Now, when you look at the mouth of the uterus, you can see that this mouth of the uterus is exposed to the vagina, and simultaneously, this is the cervical canal. Okay, cervical canal then leads into the internal os, and internal os then goes inside the uterus. So this is a very simple understanding of the anatomy. Now, for any reason, if the cervical mucus or the external part of the cervix, which is called as the external os, gets hypertrophied and it starts producing excessive discharge, that is when a lady is going to experience excessive white discharge. Understanding? And it need not be infective. For non-infective causes, it is predominantly the cervix who is responsible. All right, so please keep that in mind. So a question will come to the family physician that how will I as a family physician understand from the patient if it is an infective or if it is a non-infective white discharge? See, it is very easy. A infective white discharge is usually associated with foul smell. Please remember this. An infective white discharge is usually associated with foul smell. Okay, a non-infective discharge, okay, is usually going to be a heavy discharge. Simultaneously, an infective discharge, for example, if you have a discharge which has occurred due to chlamydia, if you have a discharge which has occurred due to candida, let's say a fungal infection, this is going to cause heavy discharge, and along with heavy discharge, it is also going to cause a lot of pruritus. Pruritus means itching of the vagina, itching of the vulva. When you have a non-infective discharge, predominantly in the non-infective discharge, the thing which you should remember is that it is just going to be a heavy discharge. It is not going to be associated with foul smell on most of the occasions. It is not going to be associated with irritation and itching on most of the occasions. Okay, so that should get you something in your head that this is something which is non-infective. Because in family physician practice, the commonest mistake which people do is that they give antibiotics to everybody. ओके, कुछ भी नहीं समझ में आता, यू गिव एंटीबायोटिक, ठीक है। आप फास्ट 3 किट दे दो, कैनसॉफ्ट सीएल का टैबलेट दे दो, कैंडिड V6 वजाइनल टैबलेट दे दो, whatever tablet you want to give na, all these tablets are not going to work because the patient has no infection. So keep that in mind. In this situation, let's assume you are a male GP who has no facility to do vaginoscopy, who has no facility to even examine. Okay, in that situation, what is very, very important for you is to understand that in this situation, even if you don't give a vaginoscopy to the patient, you should not give antibiotics. Primarily for all of these patients, okay, primarily for all of these patients, your treatment of choice is going to be very, very simple. Your treatment of choice is going to be to give probiotics. Your treatment of choice is to give probiotics along with other factors which can. And once it goes and replenishes the vaginal flora, it is going to reduce the white discharge very, very nicely. Okay, it is going to reduce the white discharge very, very nicely. So please keep that in mind. Simultaneously, for non-infective white discharge, if there is a cervical lesion, okay, for example, if there is a lesion which is suggestive of an ectropion, then this needs to be treated by giving simplistic medicines like placentric injections. This needs to be treated by giving simplistic medicines like asking the patient to do weight loss, okay, and all these other things. There are certain occasions where the ectropion is so big, that means the erosion of the mouth of the cervix is so big, okay, and this predominantly occurs in women who have had 1 to 2 children, that in that situation, usually you will give antibiotics which will not work. Patient will keep on having recurrence, and when we understand that this is an ectropion, the patient simply needs excision of that ectropion, which is done with something called as a surgery called the LEEP, that is loop electrosurgical excision procedure. Okay, that is it. Beyond this, you should not keep anything in mind as far as family physician's practice is concerned for recurrent and infective white discharge. Okay, beyond this, kindly do not keep anything else in your head. All right, I hope this solves most of the questions which people would have regarding non-infective recurrent white discharge. Okay, any further questions, we shall be happy to answer to people who are going to WhatsApp us. Okay, so thank you so much for joining, and we look forward to your the next session on the next Monday now. Okay, thank you, and bye bye.